This is BayRadio.
1st of April we're at, but no April Fool's jokes and all of that. Things a little bit different this year. And let's catch up with somebody else live. Lucky to have on as well, because bound to be a busy chap. And Dr. Henk Landa, it's been a long time. You used to be in here, right in that chair right there. It seems a while ago, doesn't it? Good morning.
Yeah, it just seems like a few days ago, indeed.
You're now based around Denia, but at the moment you're at the clinic in Ondara. What's the situation? Because it's normally the Clinica San Carlos, right?
Yeah, normally I'm in San Carlos, but in San Carlos at the moment we can only see patients over the emergency department, and we're dedicated full to coronavirus, and the real emergencies like heart attacks, fractures, etc., etc. So the outpatients clinic has been closed to save personnel so that we can rotate better. And resources are better used. So I'm based now outside of the clinic, seeing my patients that have acute problems, and anything that I can do over the internet, I do over the internet to avoid them taking to the streets, obviously, and putting themselves at risk, or myself or other healthcare workers at risk. So we're trying to, it's like risk management, risk control, what we're doing at the moment.
So the way things are going at the moment, we hear of the numbers nationally, which don't seem to be flattening off just yet, but there'll be plenty of people within the Valencia region wondering just what's going on locally. I mean, I see the figures when we do the Spanish news here, but even around where you're based, you have dealt with some positive cases so far.
That's right. But look, in the Valencian community, in Comunidad Valenciana, like the provinces of Castile and Valencia and Alicante, we're a little bit lagging behind what would be Catalonia and Madrid. Each and every community has a different outlook in this coronavirus pandemic. And the models that have been drawn up in the university in Valencia are interesting, and they actually predict that our peak will be around the 3rd and 4th week of April. So we're going to be a lot later than Madrid and Catalonia.
Oh boy, why would that be? Is it the amount of testing being done?
No, it's the amount of cases and how much time it takes to spread. And also what we have a big handicap. We don't have enough testing kits. So we really don't know the real size of the pandemic or the epidemic here in Spain. It's a bit guessing, and there are models out. And some models even predict that we have like 6 times more real cases than that we're finding and we're diagnosing. And we have another big problem, is that a lot of healthcare workers have been affected. They're either in quarantine or they are ill of the virus. And at the moment, I'm just reading up on the ABC, which is a newspaper which did a section this morning on Alicante. And as I'm looking here, there's like 41.4% of all the personnel, healthcare workers, are either in quarantine or they have been affected with the virus. And in Denia, we're looking at 53 healthcare workers that are affected, to give you an idea.
Wow.
It's 14.3% of the actual healthcare workers force. So we're looking at very serious cases. We're looking at over 1,000 cases just in the province of Alicante of healthcare professionals that are not able to work. So we're going in for a really big problem. And in Villajosa, the state hospital is almost at the verge of collapse. And they're asking for help, and we'll probably be shipping ICU cases to other hospitals. So what's going on is that the big peak will still have to come in 3 weeks' time. Our ICUs are already getting full. And on the other hand, we're short of healthcare workers.
When you see these big field hospitals being set up, you get the sort of idea of anyone that's sort of doubting how real this is. That might give you some idea when converting empty, stadiums and arenas, that sort of thing, and putting hospital beds in there. So you say there's still worse to come around the Valencia region.
Yeah, we don't have enough PPE, personal protection equipment. We don't have enough. And funnily enough, we don't even have these good masks. You have the PPF 2 and 3s, which filter 95 to 98% of particles. There's not 100%, so they don't protect you 100% to corona, but at least to a very high degree for the droplets that are in the air, which is the most infectious part of it. It's people coughing over you. So we see people in supermarkets wearing these masks, and we doctors don't have them.
Right. Is this stuff coming, though? I mean, we hear about, the equipment being manufactured by people that would normally make other things, and the testing kits as well were supposed to be arriving, then they get distributed out to the regions. What's happening with those?
We've had a scare, or bad luck, let's put it that way. Last week there was a big supply of testing kits that were false or didn't work very well. They didn't really predict to a level high enough to be considered a good test. They only had like 30% predictability, which is something like coffee grinds. So it wasn't really worth it. So they've been sent back to China. Now there's new ones have arrived about 2 days ago, but the ministry is now a bit scared. They don't want to make another mistake. So they're testing them first before they're going to hand them out. So that's all delaying it. And there's not enough equipment. There's just not enough equipment, and therefore the healthcare professionals are being infected. And funnily enough, we won't have enough healthcare professionals. So we're really in a very dramatic situation.
Yeah, and this is why we have you on, because people, will speculate and that sort of thing. But you're on the front line there, as it were, so we can get your first-hand account of how things are going. Did you see it coming? How early did you see this really being a big thing? Because people weren't sure. They thought, this is going to be another, SARS, which didn't kill everybody. But did you get the idea quite early on?
And SARS-2, this is the SARS-2 virus.
Yes, the original.
SARS-2, the virion is actually very identical, and they all both link up to the ACE receptor that we have in the lung. So that's where they actually, their point of entry, as it were, to our body. Okay, it's very identical, but the transmission and the mode of transmission is different. Mm-hmm. That is, and also the illness is different. This illness here, we're looking at around a 4 to 5% mortality rate, which differs widely from country to country. You can see that in China, the survival rate was a lot higher than what we're seeing in Italy, what we're seeing in Spain, what we're beginning to see in the UK, what we're seeing in the Netherlands, where I'm from. We also start to see it in the United States. But we have, our populations are elder. We have demographic, we're top heavy, so we have a lot more elderly people, a lot more people with comorbidity, with other illnesses. So our mortality rate is a lot higher. Yeah, so when did I first see it happen? I think most of doctors, we were reading up, obviously, on the Wuhan experience and looking into it. Having seen the gradual spread to Italy, and then how people didn't take it seriously. Unfortunately, we had the 8th March demonstration for women's rights, which I fully agree with, but it wasn't really a good moment to do so. We also had the soccer matches, obviously, in the north of Italy, knowing that there were cases there, which wasn't very wise to do. But we're finding out now we're paying for it too late, unfortunately. So when did I see it? I think we all saw it too late, to be very honest.
Yeah.
So our globalization is making things travel far faster than ever. I remember the SARS-1 years and years ago didn't travel that fast as this is doing. And I just think it's because our mobility is so high. We have so many flights going around. We have so many people traveling. There's so much contact. That is, these viruses can just travel a lot faster than they used to.
I think you're right about the when it was that Sunday with the Women's Day marches. It tied in particularly within the Valencia region with a lot of the big fiestas getting underway with the Fallas. A ton of people gathered in Valencia city itself, and so 2 weeks later, maybe just over that, you're probably starting to see some of these cases coming out. Am I right?
Yeah, that's right. Yeah. And as I say, we don't have enough testing kits. So we have no idea how many people are affected with the virus. A lot of people, especially younger people, hardly have any symptoms. They could just maybe even be sniffing or not at all. And they could be carrying the virus. Now, the good thing is the less symptoms you have, the lower your viral load is. The viral load is the amount of virus you're carrying in your body. The more symptoms you have, so if you really have a pneumonia, you're coughing and spluttering, and then you have a very high viral load, and then the chance of you transmitting the virus is very high. So people that don't have symptoms or very little symptoms, actually their rate of transmission is a lot lower. Okay, so that is the good point. But on the other hand, we have a big reservoir of people that are carrying the virus. We just don't know exactly how big that is.
That is the problem, and that's the problem when it comes to numbers. When we think we know how many people are infected, but it could be a lot more, as I think you mentioned earlier. It was quite early on that we were given the advice, you call this number, don't go along to your GP, don't go along if you think you have the symptoms. Have people been following that, or have they still been turning up to see you without going through the proper procedure first?
Very, very rarely. Most people are following it up, and I'm very glad for that. So what you have to do is, if you have a cold or you're just sniffling and snottering, stay indoors, don't go out. Don't go to your doctor. Try not to spread it to more people. If you start to feel very ill, you can phone us. Obviously, you can phone me or all my colleagues, and we will be glad to help you on the phone. And if it gets really bad, if you're getting short of breath, or if you're not able to eat or drink and you're starting to feel very, very ill now, then we contact 112.
Right.
And a special unit comes and picks you up and takes you into the local hospital, and we do testing. Now, the testing we have at the moment still takes at least 24 hours to get a result. We're still short of kits, so we do it in the very bad cases. So I have a lot of people calling me that want to do a test, and I say, well, we just don't have the test. You're not going to get it. And the tests that they are offering in a few laboratories around are not worth it, because I'll explain. We have different kinds of tests. We have what we call a PCR. A PCR is a test that we actually detect the virus itself and its structure, its antigen. And we have antibody tests. Now, antibody tests take longer to develop because, first of all, you need a certain amount of time to have a certain load of virus in your body before your immune system starts producing these antibodies, bodies against the virus. That's why they're called antibodies, okay? Now, that takes at least 7 to 8 days before we start seeing it. And so you have to be quite ill for about a week before we know if you have had contact with the coronavirus. And these fast tests, that's the one we really want, that they're coming in now. These are PCR tests that within a number of hours, we can get a reliable diagnosis if you are carrying the virus or not.
Yeah, so I think people were wondering, if they initially get tested, how long you have to wait for the results. So those initial ones, 24 hours, you were saying?
At least 24 hours, yeah. We've got new ones now that are about 4 hours, and they're being distributed. They're being distributed obviously to the places that are worst hit, and that read Catalonia, we read Madrid, read Valencia, capital, and it'll slowly come to the rest. And we hope that we'll just get enough tests that we can start testing at a larger scale and be able to actually get a better idea of how big this epidemic is getting.
Mm-hmm. Okay. Well, looking ahead, where do you see it heading as far as the vaccine goes? We see all different lengths of time being bandied about, but as a medical professional, how do you see that?
Well, usually it takes about at least a year and a half to develop a new vaccine. It's also a very dangerous process because you can actually make people very ill if the vaccine is not working very well. So you have to be very careful. And we'll have to try to get a vaccine that gives us a reasonable amount of cover. So usually I wouldn't see it developing any faster than about 18 months.
Really?
And especially that it becoming available enough to have a quantity of vaccine that would really make a difference worldwide. You're talking big numbers of production, huge numbers of production. So it's not that easy to set up.
No. Presumably plenty of people working on that as we speak.
Oh, yeah. Yeah. That's the golden thing, there's a business opportunity that I think many laboratories will not want to let go.
I should say so. And also, what about I don't hear it as much now, but about the seasonal thing, saying, once the temperatures go up and it gets a lot warmer, it'll die out.
That's more because most virus, and we're looking also at SARS-1, had that seasonal, how would you call it, rhythm.
Yep.
So as it gets warmer, the virus will survive less. And we have studies in laboratories that if the temperature goes up like 25, 26 degrees Celsius, the virus lives a lot longer on certain surfaces and cannot maintain itself that well. So that's the prediction. We don't know. We don't know if SARS-2 is going to behave similar to like SARS-1. The feelings are that it should, but we don't have proof yet.
All right. Well, look, we thank you, as always, for your time, because it's a busy time for you. It's obvious. I've come out with lots of obvious statements this morning, but great to catch up and sort of just get the real story from the front line, as it were.
A little goodbye advice to everybody. Stay indoors, stay indoors, stay indoors. Please listen to the authorities. Limit your displacements to the bare bones minimum. Wash your hands and wash your hands and wash them again. And be sure, look, gloves are not that helpful, especially if you don't know how to take them off. Taking them off is a very serious business. I advise you, go on YouTube, go and watch those little instruction films, how to take off your gloves. It's not that easy. And there's even among healthcare workers, we've been trained how to take them off. About 30% don't do it correctly, to give you an idea. And then what you're doing, you're spluttering the virus all over yourself and actually making it worse. So you might even be better off not wearing gloves. Fortunately,
if you can make sure it's genuine, there's plenty of advice online, they say, on YouTube channels and the like, and hopefully be able to check in with yourself again very soon. So when we see the people applauding in evenings on the balconies, that's with good reason. As you say, the number of health professionals affected is quite staggering, some of the numbers at the moment. So we appreciate everything you're doing.
All right. And just want to say to everybody, take care, stay healthy, and let's hope we all see each other after this terrible epidemic.